segment is sponsored by GBMC Healthcare.
Almost 20 million Americans currently have the human papillomavirus, which is the most common sexually transmitted disease and major cause of cervical cancer. Regular cervical cancer screening is an essential part of a woman's health, but too often is disregarded. Joining us to talk about cervical cancer is Dr. Fong Liu, gynecologic oncologist at GBMC and an assistant professor at Johns Hopkins. Hello, thank you for joining us today.
Thank you so much for having me.
All right, so talk to me. What is cervical cancer and what causes it?
So cervical cancer is an abnormal growth of cells on the cervix that forms a tumor that can go to other places in the body. And the most common cause of most cases of cervical cancer is caused by a virus called human papillomavirus.
Okay, now this is one that we don't hear too much of a lot of the time. Can you talk to me about some warning signs and risk factors for cervical cancer?
Yeah, so the warning signs and symptoms are often abnormal bleeding, pelvic discomfort, abnormal vaginal discharge. But I do want to stress to all of your viewers that the most important thing about cervical cancer and catching it early is really to see your gynecologist for regular well-woman visits.
Okay, that's a good tip. So how does it spread and how does it, affect your cervical health?
So HPV is sexually transmitted. And so there are many different types of HPV that can cause also genital warts. And so the important thing, once again, is to see the doctor for well-woman visits, routine screening visits, as well as to get the HPV vaccine, which has now been approved for women up to age 45, actually.
Okay, and when should those women get vaccinated for HPV?
So it's actually, and I want to stress, it's both men and women who can get HPV vaccine.
Okay.
Of course, cervical cancer only affects women. You could start getting vaccinated as early as age 9 for both boys and girls. It's recommended to start at around 11 or 12.
Awesome. Okay, lots of great info there. Thank you for joining us today, doctor.
Thank you. Have a great day.
All right.